This information is for educational purposes only, does not constitute legal advice, and does not create an attorney-client relationship. If you need legal assistance about a legal problem, contact an attorney. You're watching Healthcare Pros Charting Texas, where we break down your healthcare license risks and regulations in just a few minutes. I'm Simone Murphy, and this is your Friday Focus, brought to you by Know Your Regulator.
If I'm using gaming in a clinical setting, the most important things is I'm not going to be writing any goals that revolve around gaming. It's not going to say like patient will increase his score in Halo from like
Right.
it's not going to be like that, right? So unless that's their job, maybe if it's a job that they have to compete, that's different. But what I am going to do is I'm going to look at the things that I'm working on. So if I have a patient that comes in that we're working on potentially standing tolerance, energy conservation, maybe we're working on balance, all these different things, I can definitely look at opportunities to use gaming. So, for example, I'll give you one example that we had. So, one of my patients at one point had gotten in a car accident or something like motorcycle accident or something. He had kind of shattered the left side of his body and big guy, but probably in his 50s, loved video games. And as we were working on therapies, we were really trying to get him to stand more and to have more activity tolerance. And so we put him up at a high table and just had him engage in something, some kind of activity, basically. And this one particular one was like building a puzzle, right? We were trying to distract him by building the puzzle. He would stay up and he would be kind of motivated to kind of engage with his activity, right? So he stood up for about a minute and a half, right? And he was like, oh my gosh, I can't stand up anymore. My leg hurts too much. Like it's too much. Blah, blah, blah. The next day, and so we started talking about it, and I was like, you know what, I'm going to try something else. We're going to stand him we're going to play video games. And what I'm going to do is I'm going to take the adaptive controller, and I'm not going to use it for accessibility. I'm going to use it for therapy. So just like I can make buttons go out for people with accessibility, I can bring buttons out and make them further away from somebody. So if I want to like have him extend his arm or work on balance, moving left and right, I can put these buttons out here, right? And so I made this whole thing where his joystick was over here, there's buttons over here, and he would have to kind of weight shift to get to the other ones. The next day, he went from going a minute and a half from working on a puzzle to 17 minutes
Oh my
just playing
gosh.
video game. And I mean,
Wow.
it's as simple as being intentional with the human that you're working with, right? It's not the answer for every single patient.
Right.
It isn't. But here's the thing. So now how do I document that? Do I say patient played video games today for 17 minutes? No. But what I do want to say is that when I'm writing goals for activity tolerance, balance, all those things. And so what I would say is patient engaged in activity today designed to increase standing tolerance and balance. Patient engaged for 17 minutes while standing at high low table. And then I would supplement that this is what we did. We played video games or with a adaptive gaming setup or something like that, because the regulators are looking that you have skilled therapy in your practice. It's not necessarily what you did. Like they're not going to say, well, he played puzzle, that's skilled today, and then if he played video games tomorrow, it's not skilled. They want to see, what are you working on? I'm working on standing tolerance. I'm working on, balance. I'm working on all these things, crossing midline. I work with stroke patients with stuff like this as well. Like maybe they have a neglect, and so I set up buttons so they have to like attend to one side. So things like that give me the ability to challenge them in different ways. So the biggest issue, again, with regulation, people, well, how can I bill for gaming? Well, you don't bill for gaming, you bill for therapy.
Thanks for tuning in to Healthcare Pros Charting Texas. For more insights like this, follow along and keep learning.
Know Your Regulator, the podcast that inspires you to engage.